it was, to me, I got the privilege of like spending 10 or 15 minutes in each of your rooms, and I was pretty blown away by just the level of conversation, the ideas, questions that were generated. So this is a bit of a tall order to try and surface the wide variety of themes and ideas. So what I'm going to ask you to do is keep your comments brief. Okay, because I know a lot of, we could restart many of those very dynamic conversations. So really just try, I'm gonna go breakout by breakout. We've just got about 5 or 10 minutes for each one. So we'll keep it tight and really try to pull out just an insight or two that was really, you felt critical or really important to your conversation that you feel like the rest of the group could benefit from. And thank you for the facilitators and note takers in the room. Both of you played a really important function, and the note takers were very furiously taking notes. So there was tons that I think will be played back to everyone. So we'll just be able to touch on some of the things that came out. Okay, so for this group, Chris, who was facilitating, Mario was in the group, the first one around, or whichever number it was, around social capital, second one. Who's got something that came out for them that was an insight or an idea they'll take back? So, okay, I got to sit in on it. Let me tell you what came out with, like, what I got to sit in on. And I think it's a cross-cutting theme across all the groups. And it's what you said near the end there around the shift from a deficit to an asset-based model, and how intuitively we all get that that's good, but how on the ground that's not happening. So let's talk about that for a second, around what it really what needs to happen for asset-based approaches to really take hold. So what were a couple of the ideas that came out in that group?
Yeah, so the context was this simple idea that that even though we were all familiar with the notion that we ought to think about the low-income communities that we serve as containing assets as opposed to just deficits that we're trying to address, when it comes to thinking of ourselves as service providers, we precisely think about people in terms of deficits, as in if we see a new need, we think, well, what can we do to serve that need? And therefore, what do we need to do in terms of getting new grant money or so on to serve this new need? Rather than a model in which we see a new need and we say, well, what can the other people in the community do to help that person or that set of people or the community as a whole address its own new needs? In other words, a model in which social capital, which is one of the resources in the community, becomes the tool towards addressing their problems. And I think what's difficult about that is that cognitively, if you're trained in service provision, you're trained in service provision, right? The whole point is that you're supposed to be the servers, the server. But I think that model actually ends up being counterproductive in many contexts. The Family Independence Initiative is an initiative that actually tries to do exactly that. This is based out of Oakland, and they're a group where if you as an individual come in to ask for help, the first thing they say is, no, we don't help individuals. Go back and find, go back and find 5 other families that have the same need and then come back and talk to us. So in other words, go find your network in your communities because you have the assets. And when you return, then the question is, okay, what do you all think that you need in order to serve your needs? Awesome. And so again, it's not a model in which you provide, but in which they, as an asset-based entity.
Okay, so it was called the Family Independence Initiative. And it sounds like, I like that kind of notion that you also talked about as a group around like getting over feeling like you're abdicating responsibility by sending people away, but actually there's obviously greater value. And I'm gonna jump actually to another group because I think Cynthia in your group, to me it connects to the notion of system navigators that you talked about. So maybe you guys could say a little bit more about that conversation and potentially, because system navigation, I just led a session last week with a whole bunch of system navigators. So I'm really interested in kind of the insights that you guys had as a group around some of the potential drawbacks of system navigation as it relates to kind of deficit versus asset approach.
Yeah, that was certainly a salient theme in our conversation around service navigation, and not just system navigation and service navigation, but navigating all the different systems that we interface with. And Dina spoke about mapping out all the different points of access that children and families have across the different systems, and how do we use a common language so that when a family or child comes here and there and then there and then there to access the different services and programs, that we all know that we're talking about the same thing, and that for the family they understand that we're all using a common language and the value in having that. But also one of the other points around service navigation was part of that is also building social capital. So how do you use service navigation to help build that social capital and that social cohesion within communities and within families? And I think that that project is really interesting, and we have a lot to learn from that as we think about some of the system transformation that we have happening here in Toronto and across the province as well.
Mm-hmm. And I heard Daniele say, I don't know if Daniele just about, do you want to add kind of that comment about the onus?
Well, I think what he was saying and what we can all agree is that why we need system navigation is because we have poorly designed systems, or our systems are designed in silos. And so, somebody can be in a mental health system or a special needs system or an early learning system or an education system. And it's so complicated even within those systems. If those systems have helped to develop navigation for their clients, okay. But the fact is those systems need to interconnect, hence the Toronto Child and Family System Network, and why we're trying to do this. Because we're creating such an onus for families, and we're actually creating the burden. We're creating their deficit. Through that, rather than making systems more seamless and more apparent and more integrated. So as good as we get at system navigation, what we should be doing is designing systems that can navigate themselves.
Awesome. And that notion of like putting the burden on others as opposed to sort of taking responsibility. I'm going to go to your group for a second. Like, what I heard in what you were saying, Candace, and others were talking about the ladder and kind of putting the onus back on youth to kind of fix themselves. Do you want to say more about that? I thought it was such an interesting point.
Yeah, just there's this tension. This is nothing new. It came up in terms of self-esteem interventions decades ago, in terms of who do we focus on in terms of our interventions, right? And it's a pretty simple idea, but as soon as you start shifting some of these interventions that are being pushed right now in terms of light touch, kind of nudges to kids or building capacity in kids, are charged with kind of ignoring the broader issue of the gross inequality. So is it helpful to train a kid that the world is, they're higher on the ladder than they are, right? Is it helpful to create a biased perception in the kid the other way? So we have to be careful when we go in and try and kind of bolster up confidence or bolster up feelings of belonging, so there's actually some sort of match to the community, right? So the intervention target isn't just that sole individual. It might be their network. It's the larger community. So maybe these light touch interventions need to scale a bit.
Other thoughts from Mario's group. We can also go more broadly, but anything else that came out on social capital that you want to raise, or that? Yeah, please.
I can just bring it to our group. Yeah, mm-hmm. Okay. Is that we kept coming back to social capital. So if you're asking that question now, and that many of our systems and many of our programs, particularly we were talking about OAYC, CFC transformation, family support transformation.
Ever know that acronym?
Ontario Early Years Child and Family Centers. They are providing a service, absolutely, and a needed service, and they are bringing services to connect to families, all great stuff. But maybe what they're primarily providing is an opportunity to build social capital.
And to kind of name it and call it that, or think about
to
their work
just
through that
and while we're developing our system, to think that that's a really important aspect, not a nice to have. It is what it's doing, and so that I think that's a different way of thinking about space, and also when we're talking about how we share space. So. We talk about community hubs, and we have new efforts on bringing people together and stuff. But maybe all we need to think about is that all of that space is really an opportunity to build social capital. And so what goes in it, irregardless, let's start there, and then let's fit what the neighborhood needs.
Great. Matt, what do you or somebody from the group that was outside, I know, having a very dynamic conversation about resource allocation, what are some thoughts that came out of your group?
Perhaps related to the social capital piece, I believe it was Danovan, and I don't know if he's in here currently, but we were talking a lot about the evaluation capacity of public sector decision makers and the use of evidence in making these decisions. And he had a couple of great examples of basically using participatory action research to build the evaluation capacity of public sector decision makers, but also presumably build the social capital of those communities that are involved in that kind of research. So partnerships, being really important, and I don't think that participatory action research is thought of primarily as a way of building social capital, but perhaps inadvertently that is what it's doing.
Do you find that, Mario or Candice, in designing research to build social capital, is that an implicit or explicit goal?
A lot of the research on interventions designed to build social capital, I think, end up showing very limited effects because they're focused on trying to essentially make people become friends. In other words, right, being social. And part of the thing that I think is important in this context is social capital is a good in its own right, but it's quite difficult to get people to build social capital just because it's a good in its own right. People will do it in the context of childcare center because they'll do something for their kids that they might not for themselves, or because they know it's important for a larger thing that they worry about, or because it's a way to save money. In other words, it's the activities, it's the result of the activities that gets you there, but it's the activities that get you the social capital.
Yeah, it goes back to kind of the needs-driven work together. Do you want to say something, or did you want to go?
I was just thinking, in our group, the question came up around thinking about what other countries, like thinking about the graph that you had, Candice, on your one of your slides, and looking at where different countries sit. And so the question came up about what other countries are doing right that are further up there. So there was discussion around that. But I was thinking about that as I'm sitting here, and we're talking about social capital as well. And there's an interesting study that was done from Bhutan in Africa, where it took the index that designates countries as a developed country or a developing country, which is usually related to GDP and economic scenarios, metrics, and it exchanged that with indicators of one's happiness, community-related indicators, basically things related to happiness, social capital, et cetera, and then they mapped them out, and it was really interesting because it flipped. And those that are developing countries are suddenly developed, and those that are developed are suddenly developing. Wow. So as I'm sitting here, I was thinking about that and thinking that two things. One, there's a lot that we can learn. We often compare ourselves to other developed countries, but in terms of even doing jurisdictional reviews, we could learn a lot from other places in the world. And then here in Toronto, we have a wealth of assets of people who have grown up in those countries, who have brought that concept of community and social capital with them, and finding a way to tap into that and learn from those experiences, I think would provide a wealth of knowledge as well.
All right, we've got a few more minutes. Who else has a comment or thought, something that came out of their group discussions?
Just staying on the theme of social capital, one of the things that we kept sort of coming up against is how do you measure that? How do you measure that as a system? So as the City of Toronto, for example, wouldn't social capital be a great indicator that we layer onto our map when we are doing system planning and when we are planning for the implementation of Ontario Early Years and Child and Family Centres, and thinking about measurement and data on children? It's so important to layer those on top of each other. So how do we measure social capital, and what are some of the opportunities that we can use either as a system to measure that, like the City of Toronto, or for agencies to measure that as well?
I think, the thing I would add is when we start to measure and map, we're very careful about this at the individual level when we have children and privacy of these, but these communities also have rights, and it can become self-fulfilling prophecies in some ways too, right? So when we're mapping, we tend to map the negative things, right? And so I think finding metrics on positive things for communities to strive to and to create those maps is equally as important. And being careful about how members of that community understand and see those as movable metrics.
What are some examples of what those might be?
I think social capital is one of those, community involvement. You mentioned a couple of them, kind of your positive metrics, but, in kind of reporting out and interacting with the media and the community on those, finding these hot spots of success and rewarding on those. I mean, you're probably way ahead of me on this, but it's just...
No, it's the valid point. We do tend to focus on the negative because we want to improve.
Right.
Okay. So I know that one of the key messages out of all of this is about empowering individuals, and on the other hand, it also sounds like, or powering also sounds like you're doing it for them. So whatever the right word would be, the individual have a change. I know in some of the groups you also did talk though about at that system level, like if how do we make the systems easier? How would I was struck by your comment. I think you said that you shifted from psychology school to the public policy school. So I'd love to hear more to kind of set the stage for this part around, what made that shift and how are you seeing kind of the public policy opportunities here, partly so we can also end on a hopeful note. And for others, as we kind of take it up to a system level, like where are some of the kind of hopeful opportunities out of all this?
I guess part of the comment was related to thinking about kind of yourself as someone who wants to do good in the world and the best use of time as you kind of navigate being on the front line, whether it's in research or in service, stepping back and trying to think kind of more theoretically and careful about these things, and then, moving back, in what direction you want to take. And so I said, for myself, it was really developing kind of a deep expertise in psychology and then getting to a point where I wanted to be re-engaged. I hadn't been on the front lines with kids for a while. And so for me, it wasn't realistic to go back on the front line of service, but it was to go into a public policy school where you were forced into the front line in various ways through your students, through, engaging with the media, through having to translate what we're talking about, kind of in our own circles and silos, right? And being, I think, purposeful about that and kind of career development and thinking about, we often hear as service providers about burnout, but often it's just kind of refreshing or taking another direction, right? And keeping the end goal of where you want your career and your efforts to end up. And then it's not a failure to step out of frontline service for a while. It can be a kind of a real improvement for you and the communities you serve to come at it from another angle.
Can you just speak for a second on maybe a policy lever or two, like where you've seen policy, even in this kind of more particular setting around housing, make a difference?
Yeah, so I think there's been a couple of moments that have been inspiring here, right? Thinking about the number of agencies in Toronto that are actually thinking in a forward way. So I don't know if you know how unique you are. I mean, Mario and I looked at each other a couple of times and went, we've been around the country, it's been over different agencies, and just the level of kind of investment and forward thinking around engagement. So I think you all should be, everyone in this room who is here and is committed to this issue and is thinking in a forward way about engaging with the community and serving kids in this way. Thank you. I think in terms of the public policy research around housing, it's complicated, as you've heard, for the social mix idea. But I think there are positive stories, and I would encourage us to find those, right? And I think we can only find those through collecting the right kinds of data, and the data is there. We're in this big data world now. Those data are there, but oftentimes we get to the end point of saying, all right, we pushed and we've gotten this early intervention is now active in this area of high need. That's the success. Maybe not, right? The real success is kind of documenting how those kids' lives are affected, or those family lives are affected every day, and developing the evidence base that can allow you to advocate for more resources, or in cases, to make a bigger impact. So I'm not sure that that's a success story, but that would be something that I would advocate for in terms of kind of just checking our hopeful assumptions about what we think works against some objective data, and just never being satisfied with having the program up and running.
Other thoughts on the kind of policy or system level front that kind of you got from your conversations or have as ideas?
Yeah, I just wanted to mention that in our group in Neighbourhoods, we were talking about recognizing the challenges that you're identifying, Candace, and the realities that I think Toronto, and thank you for saying that about Toronto, I think we try hard. We actually thought about that as well. The fact that access to services is going to be a challenge. And unfortunately, no one from recreation is here, Parks, Forestry, and Recreation. But in Regent Park, which is the flagship, which Lawrence Heights is the next one, programs are free at the community center. So in order to allow for access, so people don't have to self-identify if they're the poor kid or not the poor kid, right? And that's just one example. There's challenges with that example because then everybody uses it, and who actually accesses it at 7 a.m. when programs open, and the people who have phone and 2 computers can fill up before the people who don't have to line up at 9. So not to say that there aren't challenges, but and I'm sure other people maybe have some examples too about how we are trying to be forward thinking and trying to mitigate some of those realities. Colleen, like model schools, trying to mitigate those realities and so, and that's kind of that universal targeted.
Right.
Adding on, I guess, to the conversation, I really want to thank Candace actually for her comments, raising the issues of the broader social context of justice and how are those put, because in some ways these conversations about social capital have been long lived here in Toronto as we've done neighborhood engagement and school engagement and doing this in childcare centres. However, it's yet another demand on communities that are already under stress. And when we expect them to find the solutions without bringing additional resources in a purposeful way, brings us into the larger discussions that we have often in Canada about universalism versus target and things like that. But it all wraps up to that central point that you identified of that there's a justice issue that underlines a lot of the work that we all do. So I want to thank you for that.
Thank you for making that point. Was there something else, another hand in here after Dina? Maybe we'll end with you, Matt. Was there? Yeah.
I know. Everyone's welcome to jump in anytime.
I know. I just want to get you out close.
The universal and targeted access did come up, and there were, in some cases, we're mandated to provide universal services, and so you can't just not. So there was some interesting conversation, though, about you can have access to the basic service be universal, but then having the targeted, more high-needs service being targeted. And so making that distinction, and there was one example from public health, and they had a lot of insights about balancing the universal need to access a service, but beyond the most basic level, targeting where the need is greatest. But it was it's a difficult conversation in the end, and this also came up about reallocation of resources, and that's a really tough conversation to have, and you need the evidence base to do that. But the universal and particular kind of conversation is a part of that reallocation issue.
So I know that, like I said, we just skimmed the surface of what we talked about, and I want to just thank you all for your engagement and for the incredibly important work you do. And I share kind of Candace's sense of, it's left me incredibly heartened by the sort of sophistication, thoughtfulness, data-driven kind of professionals that are in the room today. And so I thank you for coming on behalf of CIFAR and on behalf of the Toronto Child and Family Network. And Daniele, I think, is not here. And Mario we thanked, but I want to end with a gigantic thank you to Candace. I think I can probably speak on behalf of everybody. Yeah, thank you. Yeah. Again, for coming, for the work that you do, for just putting it all out there and sort of pushing the thinking and then really setting up the conversation so well. So goodbye and thank you.